Do you have a foot drop? What that means is you're unable to bring your foot up and the foot always goes down. When we walk, we move the foot up and down. So when you have a foot drop, you can actually trip and fall. Now, today we're going to be talking about the causes and treatment of foot drop. The foot drop can be on one side or both sides. I always divide it into different categories. So it could be a problem with the muscle, it could be a problem with the peripheral nerve, it could be a problem with the spinal cord, or it could be a problem with the brain. We begin the problems with the muscles. So any problem with the muscle, there are muscles that control bringing up the foot, and these muscles are located in the foot itself and in the leg. So any problem or disease of the muscle can cause a foot drop. It could be a local injury to a muscle. It could be inflammation of the muscles like myositis, or it could be muscular dystrophy from hereditary disorder. Now, typically if it's a muscle problem with that injury, it is bilateral on both sides. Then we move to a nerve problem. The most common cause of a foot drop is what we call peroneal neuropathy. With peroneal neuropathy, you have the peroneal nerve that is actually a branch of the sciatic nerve and goes around this bone, the fibula, and supplies the leg and foot muscles and sensation. So essentially, when you have compression of the peroneal nerve, you are unable to bring your foot up, and then you have a foot drop. Causes of peroneal neuropathy, it could be as simple as if people who are thin and cross their legs, they push on the nerve because there is really no fat or cushion to protect the nerve. Or people who have knee surgery, they can have injury to the nerve, or even just having the knee in a brace can compress the peroneal nerve because it's very superficial. Now, it could be a problem at the level of the lumbar spine. A disc at the lumbar spine, L4-5, can also cause a foot drop because it compresses the nerve root. It could be a problem at the level of the spinal cord. If you have this inflammation of the spinal cord like transverse myelitis, or if you have an MS lesion in the spinal cord, or if you have a disc that is compressing the spinal cord, that can give you also a foot drop. It could be a problem at the level of the brain. So if you have a stroke or multiple sclerosis or even MS, can cause a foot drop. It is important to diagnose the problem and identify the cause because the treatment depends on the cause. How do we diagnose it? We begin with the history from the patient, and we go to the physical and neurological examination. The neurologist will be able to localize where the problem is. Is it at the level of the muscle, the nerve, the spine, or the brain? And based on that, we decide the next step to confirm a diagnosis. So if it is a muscle problem, we might order muscle enzymes, we might order an EMG, we might order a muscle biopsy, or even genetic testing if we suspect it's muscular dystrophy. If it's at the level of peripheral nerve, we order a nerve conduction test and an EMG, and that confirms where the pathology is, where the nerve is compressed, and based on that, we treat. And even if it is at the level of the spine from a disc, a nerve conduction and EMG will localize it. Then we follow it with an MRI of the lumbar spine to confirm the disc and how it's compressing the nerve root. Now, if it is a problem of the spinal cord, then we do an MRI of the spinal cord. We'll show transverse myelitis or inflammation. We'll show any lesions, even masses in this compressing the spinal cord, or discs compressing the spinal cord. And finally, if it is at the level of the brain, we do an MRI of the brain to confirm if it's MS, if it's a stroke, or if it is MS. Now, the treatment depends on the cause. So if it's a muscle problem, if it's inflammation of the muscle, we have medications to treat it. If it is a muscular dystrophy from hereditary disorders, unfortunately, there's not much options for that. But if it is a peripheral nerve, like the peroneal neuropathy, which is the most common cause, we find the reason. So if it is crossing your legs, simple. We ask the patient not to cross the leg, and the nerve will heal itself. We might put them through physical therapy. And if it's after a surgery, we might also put them through physical therapy and remove the compression of the nerve. If it is at the level of the spine causing from a disc, the patient has to undergo surgery immediately, because the longer we wait on compressing the nerve, the most likely the symptoms will persist. Now, if it's inflammation of the spinal cord, there are medications for it. If it's a disc disease and compressing the spinal cord or the nerve root, a surgery is indicated immediately. And of course, if it's multiple sclerosis, if it's a stroke, or if it is a lesion in the brain, it's treated appropriately. The most important thing, if you have a foot drop, this is something that is urgent. You must see a neurologist urgently to be able to be diagnosed correctly and possibly get it treated before it persists. Thank you.